Next up, we have Dr. Greg Pursley, and he's going to be our speaker. He's going to go through proper body mechanics and stress management in a dental office. And Greg's come to our office. Dr. Pursley has, sorry, I call him Greg. We played basketball together on the Dr. Boyer basketball team, so excuse me if I don't call you Greg. Dr. Pursley and I, his office has come to our office and done a presentation, and we actually had Angie, the massage therapist, come in, and Dr. Pursley presented, and then Angie was there to give everyone in our office massages. So it was a good time. I think everyone in our office would agree. So if that's something you're interested in, talk to Key or Jamie, who's here in the front videotaping, and that may be something your office is interested in. I'll go ahead and let him get all this microphone situated, and we'll get going. Thank you. One more thing, we'll have the CE. Has everyone seen a sign-up sheet? Okay, so raise your hand if you've not seen a sign-up sheet. Okay, so, all right, so it probably came across, did it come across the front here? Okay. Where is the sign-up sheet right now? You guys have it back there? Okay, so try and get on the sign-up sheet. By the end, if you haven't signed up, then we'll find it. We'll get everybody signed up. I'm going to have the CE forms basically back where the buffet was this morning. So we'll have those, so make sure you get those before you leave. And get on the sign-up sheet if you have it. Thank you.
All right. Can you guys hear me? All right. So, like Dr. Bennett or Ross said, I'm Dr. Pursley. I'm a chiropractor here in Cape. I've been here 5 years. If anybody's interested in our massage therapist coming down and doing massage in their office, just talk to Jamie and call the number here on the screen. And we have cards and things that we can give you if you need to take it with you, so you can call here. That's something that we offer. Education is really what I like to do, especially about chiropractic, because most people don't know what a chiropractor actually does. So before we get started, how many people have actually been to a chiropractor? Good. Hopefully all good experiences. So about half the room, and that's generally typical. Only about 11% of the population right now goes to a chiropractor on a regular basis, which is about once every 6 months. Most people wait until they are in a lot of pain before they actually go. And that's some of the things we're going to go over. But I heard the first speaker took about 45 minutes and less than he was supposed to, so I'm just going to go ahead and take that time too, as well as mine, if that's okay with everybody. So we're going to do like 2.5 hours. Is that all right? Good? Okay. It'll give you enough time to sign the sign-up sheet. All right, so some of the things I'm going to go over today, similarities of chiropractic and dentistry. I know when I was asked to talk here, I didn't really know what I was going to talk about. I obviously can talk a lot about chiropractic, but I don't know much about dentistry other than what Ross has done to me. So the similarities of chiropractic and dentistry, there's a couple of them I want to go over. I'm going to talk a little bit about what is chiropractic. A lot of people don't know what that is. And I'm going to discuss that. Then we're going to go over what is subluxation. Does anybody know what subluxation is? Anybody? Even the people that have been to a chiropractor?
It's compression, isn't it? Kind of compression.
Yeah. So there's 5 parts to it, and I'm going to go over that. And it's similar to dentistry and your teeth, so I'll make that comparison for you. And then how can chiropractors help TMJ? Do you guys see a lot of TMJ coming to your office? Yeah, we do too, not as much as you guys do, but we work together to try to help people out with that. All right, so before we get started with all that, I like to have a little humor. So you guys go ahead and read that. I thought it was hilarious, my wife. Are you really going to put that up on this? Here's another one. I thought this was good. That's how dentists make all their money on this. All right, so this is the final joke, but does anybody know the answer to this? What does the dentist of the year get? A little plaque? Yeah? You guys are going to use those, I know you will. Alright, so prevention is the key, really. You brush your teeth every day to prevent tooth decay or gum disease, right? We hear that all the time. You go to the dentist every 3 to 6 months to prevent future problems. That's really what chiropractic is about. Most people use chiropractic as pain management. So once you get to the point where you're hurting a lot, then you decide, oh, maybe I should go in because I can't go play golf. Or I can't do something. So prevention is really the key. And chiropractors really do recommend every 3 to 6 months to get adjusted, get checked out. Make sure that everything is moving properly in your spine. So I'm going to go over why that is so important. So dentistry, you prevent tooth decay, gum disease, oral cancer, mouth sores, tooth erosion. Am I right? I'm not a dentist, so am I right with that?
Yes.
Right? Okay. So chiropractic, we prevent subluxation, spinal degeneration, structural instability, and subluxation degeneration. So those are the things that I'm really going to talk about. But most people don't know what subluxation degeneration is, subluxation. They sometimes know what spinal degeneration is, and structural instability, but subluxation is a term that most people look at with glossy eyes. What is that? What are you talking about? So before I get this is a chiropractic joke. I figured I'd throw some humor in myself, too. Alright, so what is chiropractic? Chiropractic uses adjustments and physical therapy to increase joint mobility and decrease inflammation. So that's, very scientific, if you will. Most people don't know what adjustments are. Most people do know what physical therapy is, but not in the way a chiropractor uses it. So I'm going to kind of go over that also. Chiropractors look for subluxation. Now, like I said, there are 5 parts of subluxation. Now, do you guys know what a dislocation is? Dislocation is when you take a joint, it moves 100% out of the joint space, right? It's pretty painful, pretty damaging to the joint, pretty damaging to the tissues, right? Now, subluxation, the definition is actually less than a complete dislocation of a joint. So that means it's not 100% out of place, but it's not in the right place. But it can be damaging, just like a dislocation. It takes time. It's based on time and gravity. So the first thing that happens when you have these subluxation is you have restriction of your ability to turn and bend. So you see somebody, oh, I just can't move and turn and bend like I used to be able to. People generally notice it when they're trying to look out the rear, or out the blind spot in their car, things like that. I just have to turn my whole body instead of just my neck. But most people don't get treated at that point. Now they do go in order. So the restriction is what happens first. After you get restriction in the spine, symptoms can start to develop elsewhere in the body. Now, symptoms aren't pain. I'm not talking about pain. I'm talking about I have my normal headache. I have my normal neck pain. I have my normal back pain. But pain isn't normal. Would you guys agree with that? Right? How many times I hear that every day? It's just my normal pain. It'll go away. It'll be fine. So, do you guys hear that? I'm sure you do. I know people with toothaches that go, it'll be fine. It'll be good. I know maybe you should go see somebody about that. So symptoms elsewhere in the body are things that people just kind of ignore, and they shouldn't. I always compare that to your car. Everybody here drives a car, you know what a car is. If your check engine light starts flashing, how many people immediately go in and get it checked out? 1, 2, not many, but most people just look at it and go, yeah, it's fine. It'll be okay. But when that thing turns solid red, you look at that check engine light and go, well, maybe I should go in now, right? That's what I mean by when you have pain. That's what people normally wait till. Then after the symptoms happen, muscles will actually start to spasm. So how many people have experienced that? When the muscles get really, really tight, yeah, I'm seeing some hands. I know a lot of people have. You don't have to be afraid to raise your hand. I won't take you out. I promise. So muscles become spasming, and then they become swollen and inflamed. And when they're swollen and inflamed, that's called a crisis of pain, and that's when I generally see somebody. So that's generally what people do with dentistry also. They wait until their tooth is about to kill them, and then they go in and go, hey doc, can you fix this? But doesn't that take longer? Right? It takes more treatment, it's more expensive, it's harder on the body, there's more pain involved. So why wouldn't you want to get checked out when you're up